Okay, so today we're going to talk about VPI. So there is a broad category, and that is called velopharyngeal dysfunction. That's just the general term for abnormal velopharyngeal function. And within that category, there are three subcategories. So there is velopharyngeal insufficiency, velopharyngeal incompetence, and velopharyngeal mislearning. So we're going to do velopharyngeal insufficiency first because this is the biggest one. This is what we're mainly talking about. This has to do with anatomy and structure. So the velum is unable to move posteriorly enough to create separation between the oral and the nasal cavities. The velum is too short, the pharynx could be too deep, and the levator veli palatini muscle is unable to retract the velum how it should. And the effects of this is it could cause hypernasality and nasal emission. So under velopharyngeal insufficiency, you see nasal emission. So what that is a leak of airflow into the nasal cavity. This can either be audible or inaudible, so you can either hear it or you won't. So it is audible on pressure-sensitive sounds like your stops, fricatives, and affricates, and it's most audible on voiceless pressure-sensitive sounds. And this nasal emission can occur with or without hypernasality. The audibility of nasal emission is due to gap size. So there are small, medium, and large gaps. For a small gap, that is under audible. So with a small gap, you'll hear a nasal rustle, and you'll hear some bubbling of nasal secretions. So that is something you can hear. For a medium gap, that is audible as well. You will hear a friction sound with a medium gap. However, with a large gap, that is inaudible. You will not hear nasal emission, but you will see a nasal grimace, which is where muscle contractions are located at the nasal bridge or the sides of the nose. So you'll see those contractions. And then back over to audible, we do have phoneme-specific nasal emission. So this is audible. This is when a pharyngeal fricative or posterior nasal fricative is substituted for oral fricative, and this is usually the S sound. This can either be developed as a compensatory production for VPI, or it can occur without a history of VPI and be due to velopharyngeal mislearning. And that is why you see that arrow going from phoneme-specific nasal emission to velopharyngeal mislearning. So the next category, we'll go in more to velopharyngeal mislearning. This is where it sounds like VPI, but it's not VPI. This is more so an articulation disorder characterized by substitution of a nasal sound or pharyngeal sound for an oral sound. So this results in an open velopharyngeal valve during production of the sound and causes phoneme-specific nasal emission. Now we have one more category left, and that is called velopharyngeal incompetence. So we had velopharyngeal mislearning, which was due to articulation. We had velopharyngeal insufficiency, which was due to anatomy and structure. And now velopharyngeal incompetence has a neurological basis. So there's nothing wrong with the anatomy. The velum and pharynx are normal size, but the velum does not move as expected. And the causes for this include stroke or traumatic brain injury. So that is a little summary all about VPI and the different characteristics you might see.